Quite simply, this is one of the most advanced cancer centres in Europe, with some of the best staff and best facilities for the diagnosis and treatment of cancer. If I were a GP or a hospital doctor referring a patient for more specialised care, I'd want them to come here. We've got an international reputation for the quality of our cancer treatment, and that means we can attract the best specialists from across the world.
I feel very comfortable suggesting that patients can be referred to Barts for their cancer care. We have world-class facilities here, both on the diagnostic side as well as on the therapeutic treatment side. The staff are incredibly caring and every patient has a key worker. The hospital has been designed with the patient's privacy and dignity in mind, and the whole environment of the hospital is very comfortable and reassuring for patients.
We follow international best practice, bringing together a multidisciplinary team of healthcare professionals, each with their own specialist contribution to every patient's care. This coordinated approach means that every patient has the highest level of expert care at every stage. Barts Cancer Centre has the benefit of being part of the wider Barts and the London NHS Trust, which means we have a wealth of specialist backup for patients with comorbidities.
It's very easy for referring clinicians to contact the consultants here at Barts to discuss any aspect of the patient's treatment or care. All of the consultants' direct lines are up on our websites, and we're actually very happy to have that communication with the referring clinicians at any time.
Every patient has a clinical nurse specialist for their particular cancer type, so that they have the very best treatment and support throughout their journey through the hospital.
The clinical nurse specialist is a well-educated, highly qualified cancer nurse specialist. The main advantage for the patient is that they've got a point of contact who they can trust, somebody who will return their call, knows exactly what they're talking about. The referring clinician would have peace of mind that the patient was being looked after physically, emotionally and psychologically, and that the clinical nurse specialist was going to be a constant part of the patient's treatment pathway. So they would always be there for the patient.
Barts is an excellent hospital. It's the best treatment you can have here, and the staff are very caring. I don't feel any discomfort.
I think the staff are absolutely wonderful. They're not only good, they're absolutely dedicated. Nothing is too much trouble, you know, they really look after people here.
Barts Cancer Centre is quite simply a beautiful and healing environment. It's light, airy and spacious. Almost half the rooms are singles, and all of the wards are single-sex. Everything is focused on the comfort and safety of the patient. From our new chemotherapy suites through to the operating theatres, even down to the way we now operate our radiotherapy facilities so that the patient can have their treatment before or after their normal working day. Our doctors and cancer researchers work with the most up-to-date technology for diagnosis and treatment available anywhere in the world.
Our radiographers use the latest generation of diagnostic and radiotherapy equipment, such as the MRI scanner, the 64-slice time-of-flight PET-CT scanner, the gamma knife, and the linear accelerator. These are capable of delivering intensity-modulated radiotherapy and image-guided radiotherapy with pinpoint accuracy to more tumour sites than ever before. Crucially, from a research perspective, this diagnostic equipment allows us to monitor the effects of cutting-edge interventions. We rank alongside some of the best-equipped cancer centres in the world.
Doctors at Barts have been making discoveries since the hospital was first founded 900 years ago. We've pioneered advances in surgery, chemotherapy and radiotherapy for the treatment of cancer, which have been now adopted worldwide. Our research continues to be recognised for its originality, significance and rigour. And the results of the work that we do here constantly lead to new advances in the treatment and care that we can offer patients.
Research and treatment of patients at Barts are very, very closely aligned. As a result of having large numbers of clinical trials open, we can frequently offer patients novel therapies a long time before they're available commercially.
Patients who are no longer responding to conventional forms of therapy may be candidates for research trials of novel approaches carried out in our Centre for Experimental Cancer Medicine, an integral part of the Cancer Hospital. There are only a select number of these centres in the United Kingdom, and they are highly specialised. As well as these highly experimental trials of novel agents, we have over 100 clinical trials open at any one time, covering a wide spectrum of cancer types. We think it's really important that such a high proportion of the patients who are referred here have an opportunity to take part in these clinical trials.
Well, I had leukemia and I went on a clinical trial which the doctors offered me at Barts. I had the mini stem cell transplant. 3.5 years later I'm still here and I'm grateful.
If I were to sum up why I'd refer a patient here, it's because the Barts Cancer Centre has the resources, the specialists and the knowledge to offer patients the best treatments and outcomes possible. Patients are our #1 priority.